Let's talk about some of the sensory problems now. Conjunctivitis is just as it says, it's an inflammation of the conjunctiva. Anytime you see itis on the end of a word, it means inflammation or infection. So this is easy to tell. The eyes become really red, irritated. Cataracts are when the lens of the eye hardens and it becomes very cloudy. So it's almost like wearing glasses that are covered in Vaseline. Vision's just very cloudy. It is possible to have cataract surgery and have that lens replaced, which can sometimes reverse that cloudiness. Glaucoma is related to aging. That's the most common form. There is an acute form of glaucoma, which is when the pressure inside of the eye becomes so high that it causes damage to the optic nerve. But mostly what we see is glaucoma related to aging. So what happens with glaucoma is you start to lose your peripheral vision. So things from the outside in you might not see. So sometimes it takes a little while before the person may even realize that this is happening. Macular degeneration occurs when there are macular deposits inside of the eye that affects your central vision. So it's kind of the opposite of glaucoma, where glaucoma affects your peripheral vision. Macular degeneration affects your central vision. With diabetic retinopathy, there is damage to the eye related to those high blood sugars. Always remember that your eyes and your kidneys are very sensitive organs, so they don't like environments that are acidic or there's a lot of pressure. So your eye, the little tiny vessels in your eye start to become damaged. Sometimes they burst with diabetic retinopathy, and then that person sees floaters. So just imagine walking from a really bright, sunshiny place into a dark room. You start seeing little floaters everywhere. That's kind of what it's like. And then, of course, blindness, and these can all lead to blindness. So some of the endocrine problems, there are an endless number of endocrine problems. So we're just going to talk about a couple of them. So growth hormone, that's related to your pituitary gland, and it's just what it says. It's the growth hormone. So if you have an abundance of that, you have gigantism, so the person's very, very large. Think of Andre the Giant. And if you don't have enough growth hormone, possibly you could suffer from dwarfism. Thyroxine is from your thyroid gland. So an overproduction would lead to hyperthyroidism. So that person would have, it's kind of like an excess of metabolism. They might be very thin, anxious, have a high heart rate, and sometimes have bulging eyes or goiter if it's not treated. Hypothyroidism is when there's not enough thyroxine. So this person is going to be very tired, maybe gain weight, have trouble losing weight, just not have any energy. So the most common disorder that we see related to the endocrine system is diabetes. So that has to do with insulin production or use. So there's two types of diabetes. There's type 1, which is the inability of the body to produce insulin. So that person would need to be on artificial insulin, needs to have it given to them, or they will not survive. Or type 2 diabetes, which is a combination of not enough insulin production and the cells become resistant to insulin, and that's mostly related to poor dietary habits. You know, in the U.S., we like to eat a lot of sugar, especially early in life, and that causes the cells to become resistant to sugar or to insulin, so it can't convert sugar. So hypoglycemia is when the blood sugar is too low, so the person might feel very weak, maybe confused, they might be sweating. Hyperglycemia, the person might not have any symptoms of that, but that's when the blood sugar is too high. So problems with the digestive system, there are ulcers. These are sores that affect the lining of your digestive tract, and it could be anywhere from the mouth down to the anus. Any anywhere in the alimentary canal, you can have an ulcer. Hernias are when an organ protrudes through a muscular wall, so that can really happen anywhere. They're fairly common. Sometimes they can be surgically repaired, sometimes they just decide to monitor it. Gallbladder disorders, gallstones can block the flow of bile, and that can cause inflammation to the gallbladder, and the gallbladder can become infected, and it can even become necrotic. So sometimes the gallbladder will have to be removed for that reason. So some other disorders of the digestive tract, of course, cancer, ulcerative colitis. There's so many that we don't necessarily mention, but those could also lead to the person requiring an ostomy. An ostomy is when part of the colon or large intestine is removed. Sometimes it's so severe that part of the small intestine has to also be removed. And we create an artificial opening in the abdomen that kind of takes the place of the anus. So we will cut the diseased bowel out. We'll create an opening in the abdomen. And then you can see here, we will pull the healthy bowel through to the surface of the abdomen so you can see this stoma from the outside. And now stool is going to travel and empty out through this stoma. So we will put a colostomy bag on top of this because this person is now not going to be able to control their stool, right? You don't have a sphincter there, so it's just going to come out. So you guys might see these in clinical. This is not a sterile thing, so you can certainly empty them. In some places, let CNAs change them if you've been trained to do that. Some urinary disorders. Kidney stones, if anybody's ever had one, you know that they are extremely painful. This is when a stone, which can be formed from different things, blocks the flow of urine. It can become pretty serious. If it's a complete blockage, it can cause hydronephrosis, where the kidneys become really inflamed because that urine is not passing through the ureters because of that blockage. Enlarged prostates are pretty common in elderly men. The prostate continues to grow, and that tissue can cause blockage of the urethra, which can cause urinary retention, meaning that that gentleman's going to have to go to the bathroom over and over and over again, especially through the night. And it can also lead to bladder infections as that urine's just sitting there and it's not fully emptying. There's also kidney failure. Remember I said your kidneys and your eyes are very sensitive organs, so high blood pressure, high blood sugars can cause kidney failure. So if that's the case, this person may eventually need dialysis, where we hook them up to a machine through a graft created right here. That's created through sewing a vein and an artery together. This is called a fistula. We will hook them up to a machine here and artificially filter that blood for them. This is not a cure-all. It's not as effective as your kidneys, but it does give them a little bit longer life expectancy. They could also have peritoneal dialysis, where we hook them up to a machine into their peritoneal cavity. Kind of looks like a little port hanging out. And through osmosis, we will filter that waste out and then drain it. So that's a pretty interesting procedure, and we won't get much more in depth with that. Just know that if you do have somebody who has a fistula, you can never, ever put a blood pressure cuff on that arm or a tourniquet or anything that's going to constrict that blood flow, because it can really damage that fistula. And if you do damage that fistula, then now that person's not able to get dialysis. And so that's a pretty big deal. So always make sure before you take a blood pressure that you know that you can use that arm. Neurogenic bladder, if somebody has had nerve damage to their bladder, they may not be able to control their urine. So sometimes they have to be catheterized in order to get that urine out because they don't have any sensation there, and it can lead to retention and infections. And then we have the urostomy. So if somebody has to have their bladder removed for whatever reason, cancer or damage to it, we can create an artificial bladder for them using intestine. So if that is the case, we would hook the ureters right up to that artificial bladder, and then there will be a stoma. Instead of stool coming out of it, there'll be urine coming out of it. Some of these things you just have to see to really fully grasp what it's going to look like. So the last thing we have to talk about are the reproductive disorders, and really these mostly just STDs. So prolapse is when an organ falls down, basically. So a prolapsed uterus can occur and it can fall through the vaginal wall. It's just it becomes weak, muscles become weak, and it starts to fall with gravity. So you may see that, and that usually has to be surgically repaired. Herpes simplex is a virus. It causes really painful blisters in the genital area, and it can spread to other parts of the body. Gonorrhea is bacterial, and remember, anything that is bacterial we can treat with antibiotics. Viruses we cannot treat with antibiotics. So gonorrhea, as long as we catch it and we know what it is, we can treat it and get rid of it. The problem with gonorrhea is sometimes with males there are no symptoms, so they may unknowingly be spreading that to their partners, especially if they have multiple partners. And STDs are something you really have to be aware of in the elderly. This isn't something we normally think of, but they are sexually active and they're not always using protection, and they're not always aware of the risks involved with having multiple partners. So that is a population that we really need to look at. The STDs are spreading rapidly in that population. Chlamydia is also bacterial, so that can be treated with antibiotics. If this is not caught within a reasonable amount of time and treated, it can cause a lot of scarring, and that can lead to infertility in females. Genital warts are just warts in the genital area, but this is a viral thing, so we cannot treat it with antibiotics. They can be surgically removed, but it is something that is going to remain in that person forever. And then syphilis is bacterial, so it is easily treated if it is known. It can cause painless lesions, which is kind of the classic symptom that you would see. So the person has lesions, but they don't have any pain with it. It can lead to rash and fever. It can then lead to paralysis, dementia, and it will lead to death eventually if it's not treated at all. So, fortunately we live in the 21st century, so we have antibiotics now to treat these horrible infections. Like I said, that is a very brief overview of these diseases. Make sure you still read in your book so you can get a little bit more knowledge about them, and we will discuss these all in class.